COVID-19 has had a massive impact on the healthcare system. The fear, not knowing enough about it, and its transmission caused us to step down our elective surgical list. So we weren't just doing the routine surgeries, but only doing emergencies and cancer surgeries. We didn't want our regular patients coming in and to be exposed to COVID just because we're coming in for hernia repair or something like that. We also had quite a number of our staff in our department contact COVID-19 and had to be isolated. Some of them had to be treated. Some of them were contacts of contacts, so we had to step them down from the floor. So it was quite difficult for us. It wasn't always easy for us to get free-flowing PPEs, personal protective equipment, for us to feel that we can go ahead with this case. We pushed and pushed. We eventually got it, but sometimes it was hard. Coming in every day to work as an anesthetist, you have to come in to do surgery. On the personal aspect, it was also a little bit daunting. Coming in, then going back home, then coming in and going back when everybody else at home is on lockdown. But we took all the necessary precautions we felt we had to take, and we came in and did the job. I remember when we had the Ebola crisis a couple of years behind, we weren't quite ready as a country, as Lagos State, and as a hospital. So we were forced to go in and make these preparations for the Ebola epidemic as well. And so when the COVID came, we were able to fall back on our experience with the Ebola. That's why it didn't take this particular center long to be able to say, okay, bring the patients in, that kind of thing. It didn't take us too long because we could fall back. We just went, what are the structures? What do we use for Ebola? Okay, let's try and change that. Let's make this isolation center. And so we were able to, I think we were one of the first to be able to say, you know what, bring in the COVID patients and we'll take care of them and we'll even operate on them. So we would always learn from, we should always learn from experience. And we should keep on continually training staff. It is so important that all the things we should be doing, washing our hands all the time, should have been the norm. We shouldn't need to teach washing of hands. It should be the normal things we do all the time being healthcare workers. So we need to emphasize it. Even when we get over this COVID, we need to emphasize all those preventive personal health measures that we can take, as well as the added ones of distancing and face masks with COVID as well. More education, practice all the time, and not just wait for when we have an issue and then try and get people in. So more training, I would say.